The mission of the Occupational Safety and Health Act of 1971, known as the OSHA or OSH Act, is to send every worker home whole and healthy every day. Let's take a look at the Occupational Safety and Health Act. The Act requires employers to provide a safe workplace for all employees and provides a process for investigation of complaints of unfair practices and a process for workplace inspections. The Act covers private sector employers and employees in all 50 states and certain territories and jurisdictions of the United States through the federal act or through state-approved programs. Since the passage of the Act, U.S. employment has nearly doubled, yet workplace fatalities have declined by more than 65%, and occupational injury and illness rates are down 67%. These results come from a combination of efforts by OSHA, state partners, employers, unions, advocates, and safety and health professionals. The Occupational Safety and Health Administration, known as OSHA, enforces the Act and other safety and health regulations in the workplace, provides outreach programs, education, and compliance assistance to employers. OSHA requires an employer to provide a workplace that's free from known hazards to health and safety that complies with OSHA guidelines. Compliance officers have the right to inspect businesses and can issue citations when health and safety hazards are discovered. Citations list the violation, the financial penalty for the violation, and the time period for which the violation must be corrected. Employers can contest these citations before a hearing board. Employers are responsible for notifying employees of OSHA standards, and employees are responsible for following the standards. Employees have the right to report their concerns to OSHA and can even request an inspection without their employer finding out they made the request. Employees have the right to know how their complaints are handled and to be advised of any actions taken. They can also request an informal review of a decision to not inspect an employer. Because of the sheer number of workplaces that OSHA has the authority to inspect, it's developed a system for inspection priorities. The administration's top priority is to inspect reports of immediately dangerous situations. The second priority is to investigate fatalities and catastrophes that have resulted in 3 or more employees being hospitalized. The third priority is to respond to employees' complaints about unsafe or unhealthy working conditions. These complaints can be anonymous. The fourth priority involves following up on referrals. Following any inspection, OSHA conducts follow-up and monitoring inspections to make sure any hazards are eliminated and employees are safe. OSHA also conducts planned inspections of high-hazard industries or occupations. OSHA has developed a number of programs to recognize employers who are committed to ensuring that their workplaces are safe and healthy. The Strategic Partnership Program enables OSHA and its partners, employers, employees, and their unions and associations, and other stakeholders to develop a written, signed agreement to work together to address critical safety and health issues and to measure the results. Another OSHA program is the Voluntary Protection Program known as the VPP, which focuses on establishing a cooperative relationship between OSHA and organizations that have comprehensive safety and health programs. The program recognizes the outstanding efforts of these organizations. OSHA is also available for consultation services to help employers establish workplace safety and health programs. When a firm requests a consultation, OSHA will appraise its mechanical systems, physical work practices, environmental hazards, and current safety and health programs. Employers have 8 hours following a work-related death of an employee or work-related accident leading to the hospitalization of 3 or more employees to report the information to OSHA. Firms are required to use OSHA Form 300 to log their work-related injuries and illnesses and OSHA Form 301 to provide specific details about incidents leading to injuries or illnesses.